wild and crazy. It's been wonderful. And again, another very controversial topic, which is cervical cancer. And my phone guest this hour is Dr. Kecia. It's Kecia Gaither. Kecia, you've been on the show before, right?
I certainly have, and thank you for inviting me.
Oh, my God,
again.
that sexy voice. Kecia is a double board-certified physician in OBGYN and maternal fetal medicine and holds a master's degree in public health. Anything else? I mean, really? I mean, at least I sing, and I was a physical therapist, and now I'm a doctor, and now I do this radio show, so there you go. So you are both grounded in research, and you're expert, professional experience in caring for women in diabetes, HIV, and obesity and pregnancy. So you've been busy. That is true. So we're going to talk about cervical cancer, and I think it's because of that article that came up in the Times this week about the increase in cervical cancer, I believe, in African American women. Is that correct?
Absolutely.
And that's an issue. I mean, I'm not even sure what's going on with that, but I didn't know if you wanted to talk about that. But, I think there is a wider racial gap found in cervical cancer deaths, and I think that was what the article was about.
Yes, absolutely. We can discuss. We can definitely discuss. Well, first and foremost...
Okay, I just want to say we have to welcome also Dr. Elizabeth Nugent. Is she coming on in the second half of the show, or she's with us now? She's with us
I'm
now.
with you now. Thank you so much for inviting me.
Guys. Yes, I'm so happy. I knew somebody was coming in the second hour, but I guess that's my second hour, my second half of my second hour. Okay, but that's wonderful. So everyone's here. I'm so thrilled, and for some reason, Elizabeth, I don't have any information about you.
I'm a gynecologic oncologist in Houston, Texas, and I spend a majority of my time taking care of patients with cancer, some of which have cervical cancer.
Yippee. Kecia, I think we got a great show going on, which is, absolutely wonderful. Yeah, this is unbelievable. So thank you so much, everyone, for getting on the show. So, Elizabeth, what do you think that this disparity was all about?
Well, I think that there's probably a lot of things that are causing this disparity. I think a lot of it is based on who gets screened for cervical cancer and when they get screened. And I think that's probably very important. And I think it's also probably associated in the future, particularly with people who choose to get the HPV vaccine and those who do not.
Do you think that played a role in this?
So I don't think that the HPV vaccine right now played a role because we haven't been giving people, certainly large numbers of people, the HPV vaccine for a very long time, for many years. And the real expected benefit that we're going to gain from the HPV vaccine is looking in the future, maybe around the years of between 2040 and 2050 is when we're expected to really see a drop in cervix cancer in the United States because of the vaccine.
Guys, I'm going to ask you, do you think that there's a cultural disparity in terms of like going in, getting tested, being compliant or anything like that might be playing an issue, or fear of the doctor, or what do you think? Kecia, what's your thought on that?
Well, I think to a certain extent those issues certainly do exist. I think one of the other things that it's important to note that when we talk about the HPV vaccine, a lot of the subtypes of the HPV virus aren't covered within the vaccine that most women of color tend to have. There's certain subtypes that, the HPV vaccine just doesn't cover. And it's been found in some studies that, some women of color have other subtypes that just simply aren't covered by the HPV vaccine. So that in and of itself might be a reason why there might be such a disparity in the findings.
Well, you know what, guys, I'm just going to call you guys. You know what I've been seeing is the patients will come back. We always subtype, when they come back, especially the young girls, and I'll get HPV high risk, negative for 16 and 18. They've had the vaccine, but then they're positive for another high risk. Mm-hmm. So we're seeing that. Is anybody seeing that as well, or no? Elizabeth, Kecia?
I've seen it.